My name's Dr. Andy Lee, and I'm the neuro-ophthalmologist here at Houston Methodist Hospital. And today we're going to be talking about two very special forms of optic neuritis. And optic neuritis is a fancy word that means itis, which is inflammation, just like arthritis or arteritis. This happens to be optic neuritis because the inflammation is in the optic nerve. And the most common cause of optic neuropathy from optic neuritis is actually multiple sclerosis in young people, but you need to know about two mimics of multiple sclerosis that we're going to be talking about today that are antibody-mediated, and the two antibodies are abbreviated NMO, which stands for neuromyelitis optica. Neuromyelitis optica simply means that it's an optic neuritis, neuro and optic, plus spine inflammation, which is called myelitis. And that NMO has an antibody, and that antibody is against aquaporin 4, AQP4. So aquaporin 4 antibody is the antibody for NMO. And the second antibody that we need to know about is called myelin oligodendrocyte glycoprotein. Myelin, because the target is the myelin, the covering of the optic nerve. Oligodendrocyte, which is the cell that is in charge of making the myelin and supporting the myelin in the central nervous system. And glycoprotein, which is the cell surface receptor that your body's immune system identifies in fighting against infection, and it makes a mistake and attacks you. So the two antibodies are MOG antibody, and the disorder is called MOGAD, myelin oligodendrocyte glycoprotein associated disease. And for NMO, the antibody is called aquaporin 4, and that causes NMO spectrum disorder. So the things you need to know are it looks different than regular MS optic neuritis in a number of different ways. The first is that optic neuritis from multiple sclerosis is usually unilateral. So if it's bilateral, that's already a big red flag that maybe we're dealing with one of these MS mimics. The second thing is optic neuritis from MS is usually young white females, because multiple sclerosis is a disease of young white females. And so if there's any disparity in the demographics, African American patient, Asian patient, older patient, or male, you should be thinking about these MS mimics, the two antibody-mediated ones, aquaporin 4 NMOSD, and MOGAD, myelin oligodendrocyte glycoprotein. And the third thing is the disc can be swollen. And so normally in retrobulbar optic neuritis from MS, the disc looks normal. The patient sees nothing, the doctor sees nothing. But when the disc is swollen, that's also a clue that maybe we're not dealing with regular MS-related optic neuritis. The other thing you should know is that the MRI scan can help us differentiate MS from the MS mimics. So in an MS patient, they have multifocal white matter lesions, either in their brain or spinal cord or both. But if the MRI shows no white matter lesions, that's already a flag that maybe it's these antibody-mediated ones. And for NMO, we're going to be looking at the spine for the myelitis, and that's 3 contiguous segments of vertebral enhancement or T2 change in the spine. That is a transverse myelitis, the defining hallmark core feature of NMO. There are other core features, including area postrema syndrome, which is nausea, vomiting, intractable hiccups. But it can also present as brainstem presentations, diencephalic presentations that are not typical for MS. In MOGAD, the nerve sheath is what enhances, and if the enhancement pattern goes into the sheath or is perineural, that's also atypical for demyelinating optic neuritis from MS and suggests MOGAD. For NMO, the radiographic enhancement of the optic nerve that we're looking for is longitudinal extensive enhancement. So longitudinally extensive enhancement in the spine, 3 vertebral segments. In the optic nerve, longitudinal enhancement means greater than half the nerve is enhancing. And so there are radiographic features and clinical features that can suggest that we're not dealing with MS, but an MS mimic. You should be ordering the antibody tests in these patients, the 2 antibodies, aquaporin 4 for NMOSD, and MOG, myelin oligodendrocyte glycoprotein, for MOGAD.